April 17th. Friday, April 17th, Dr. Malone. We are coming to you live from downtown Pensacola. We had another productive day at the firm, got a lot of stuff done in the office. We also had another Zoom deposition today, and another couple meetings with potential clients today via telephone. Both of those were telephone today. And we were able to trade documents back and forth via email and HelloSign, I think is the name of the app that allows you to sign documents. So it all worked out, but there's a lot of talk about people coming back into the workforce, and I wanted to let you, from a medical standpoint, as an internal medicine doctor, sort of tell us what the update is locally with the medical side of this, and then I was going to talk a little bit about where the national sort of the federal government is sort of moving as far as trying to get people back into the workspace. So why don't you first give us some medical last day? I know we're doing this a little earlier today than we typically do, but you have yesterday's information and anything you've gleaned up until this point today.
Yeah, so just to give everybody a little bit of context, we've been shooting, this is like 2 hours early, we're shooting this video today, and generally we have the 5:30 Central time zone releases by the time we're shooting, so we don't have those today, but we got the morning numbers and some of the other releases. And I guess the big news today was that I guess the city of Gulf Breeze has got 9 cases that are associated with long-term care facilities, 8 just in one facility. And so they put out some news releases in regard to that. Obviously didn't disclose any personal information. It sounds like there was one couple that had traveled internationally at some point who live at a assisted living facility or some similar type facility. So that was the new thing there. Otherwise, long-term care facilities in the Escambia County and greater Pensacola area is 52, which is unchanged from yesterday. And the county has gone from 277 up to 282 over the course of the night. So this morning's numbers are 282 in the county, still 6.7% test positivity. I've kind of been ignoring some of the social distance grading because it really wasn't changing a whole lot. However, I did notice a dip. Escambia County like C- to D range. But then the news with the Gulf Breeze and some of the Santa Rosa deaths that are, I guess, accumulating made me look over there, and Santa Rosa County is actually an F right now, which I don't think
Santa Rosa County's an F?
For the social distance scoring, yeah. So I hadn't seen a whole lot of Fs on there. I mean, I saw a lot of Cs and Ds with the different counties I've been watching over the last many weeks. And to see an F on there, like they color it differently, it kind of caught my eye. So not saying that that's a cause to any of the data there, but it's something that, you can link.
I would point out, just again, this is just casual observation on my part. I told you this week when I come in here twice a day to check on things here at the office and to shoot this, I have noticed as much traffic as you would notice on a non-school day. Like every other businesses seems to be working, and then downtown is also, it's louder, there's more people. I'm not sure where all they are, but it seems to be busier downtown. So I'm not sure what's going on with that, but I hope it doesn't take us having more deaths for people to start paying more attention to the social distancing score. But that's not good news.
The other thing that I did see as far as interesting numbers, just kind of let you know what the bandwidth of the medical care in our area is the available ventilators per the county release is 220 at any given time, and I guess there's 173 that are available of those 220. So I mean, seeing that is obviously reassuring, but it also falls in line with where I'm thinking, there's going to come a time where they start opening the use of some of these up for elective, procedures, because that was one of the limiting factors when it was, across the board, stop all elective procedures. So, so ventilators got plenty of bandwidth, and then hospital beds in the county. There's 1,300 available, or at 1,300 at any given time, and there's 500 that are open at this time. So there's still some capacity there.
On the hospital issue, I've had several people that are involved in car wrecks. There was a dog bite case earlier this week, and some clients have expressed reluctance to go to the hospital because they are concerned about the virus. And what I tell them is, look, now is probably the best time ever from a catching something at the emergency room standpoint to go to the hospital, because the hospitals are paying more attention to that communicable disease situation and cleanliness and sterilization and controlling the flow of germs in and out of the emergency room, probably more than they ever have. And so I don't think, even though I understand that it's not really where you want to hang out, but you shouldn't think that you're going to walk into a bunch of COVID patients sitting in a waiting room coughing on each other. That is not what you're going to see. You're going to see very clear segregation for COVID and non-COVID situations. So
Yep.
I urge, and I've been telling my clients this, look, you can't do anything different. You can't take your health. I mean, these are people that have active bleeds and they're, potential fractures and from serious car accidents. And I'm like, look, you're going to have to go to the ER. I mean, you
Yeah.
can be somewhat selective about which ER you go to, perhaps. Maybe go to one that doesn't have a COVID testing center in the parking lot, right? But even those places are going to have non-COVID emergency waiting areas. And they're all going to be ultra sensitive to this. You're probably going to have to go do 3 checkpoints before you can get to a waiting room. So long and short of it is, don't not do that because you're worried about COVID. Okay. If you're involved in a traumatic accident and you have pain or you're bleeding, you need to go to the ER. Okay. They have it set up to where you're not going to be at high risk to get the virus from going to the ER. Sorry, I just wanted to put that in there.
No, I completely agree. And to that point as well, I think early on when we were doing these videos, one of the questions we fielded was, hey, I'm due to get some blood work. Should I go or not go? And at that time, I said, well, these lab personnel, this is what they do. Universal precautions is what they do every single time. So I would feel completely safe going in there to get my blood drawn, seeing as how they're always gowned up and gloved up and masked up and all that. So it's second nature for these people. So if you're due for something or if you're injured, definitely seek medical attention. Don't sit at home and try to ride it out or, suck it up. I wouldn't do that.
Yep. All right. And then we were going to chat about, I think, some other stuff that happened late last night and this morning in regards to, I think there were a couple of TV doctors that were Dr. Oz and Dr. Phil that were suggesting that, look, car wrecks kill more people every year than this and blah, blah. And then I think there was an article that addressed that issue and basically it said, look, if you assume this was all the deaths that they were going to have, there's this article here. They did a graph that got my attention. In fact, I tweeted it from my personal Twitter account. When you look at this graph, and I'm laughing because it's so dramatic. It's like, come on. The other thing that caught my eye, Dr. Malone, is how consistent this car crash thing is and how consistent heart disease and cancer. Has it been that way for years?
Yeah. And, we spoke about this earlier this week about the STEMI alerts for
Right.
heart attack. It's so consistent across the population that to make a big change, it's like on the level of coronary artery disease there would need to be like a miracle drug that got rid of it in a huge amount of population to see that thing budge up or down, hopefully down. But
it probably has stayed the same, is what you're saying, right? That probably stayed the same.
Yeah. Over time.
Yeah.
I mean, and that's population wide. So when they see that they're having 30% fewer STEMI alerts at these large, high volume facilities that do STEMI alerts all the time, then that's to say people aren't going to the hospital. It's not that these things they're still happening. They're just not going to the hospital.
We had worked up to a point in this country where people were so sensitive to chest pain that they were going at the drop of any kind of chest discomfort, right? And And now I guess those people that would have otherwise probably gone at the first sign of any kind of chest discomfort are now like, oh, it'll be okay. And it's not certainly not bothering me enough to go deal with that. Right. And that's not a good idea, people. So you look at this line of heart disease. At the very top of this, it doesn't, I mean, that's the weekly average, but look how high it is and consistent the weekly average is for 2017. And when you look at COVID during the same time period, I guess you're just looking at how dramatically the death rate has increased per week with this virus. And comparing it to anything else on this graph is a little ridiculous. So
well, and when you say, oh well, COVID is a different kind of a disease process than coronary artery disease, well, look at the flu one. Look at the rate of increase of the flu, which is probably any of the flus, which is probably the closest as far as disease process. I know it's different pathogens and different mechanism, but to see that among the viruses it changes that rapidly is concerning as well. So,
and I get that there are portions of this country that have not been affected by this yet substantially, but I think that what needs to occur is that everybody needs to at some point realize that no matter where you are in this country, no matter how small your area is, unless you're under a rock, literally, and you never interact with anybody that comes in to the outside world, your community is going to be affected by this at some point. It may not be next week, but it's going to happen. And so it's just the way these things are. All right. So, Dr. Malone, what else do you have for us? Well, about a new drug that came out that they said it begins with an R. I can't remember the name of it.
Yeah, we can jump to that. So let me get that pulled up here. We mentioned it last week a couple of times, and then it started making news again this week. So this is the paper that where they had approved it, the remdesivir for compassionate use, and we had made mention.
What's it typically used for?
Well, so this came out for use with Ebola, and that was what it was being researched for use there. Thinking, hey, it's an antiviral. So the mechanism is that it stops once the has infected a human cell. Inside of the cell, while the virus is trying to take advantage of the cell's machinery to reproduce, this supposedly the idea is that it cuts off that reproduction inside the cell. So you got infected, but the infection did not go viral, which is where this term came from, where one virus infects a cell and many progeny come from that, where this thing just becomes a factory to make more of the viral particles. So the machinery of the cell gets hijacked, and the remdesivir blocks that. And I have another image I'll share. We're linking all these articles too, in case if people are interested. Let's see here. So this is a good article that was in, let me get it pulled up on my end here, that was in Science magazine. And
wait a minute, is that a swab? What is that surgeon?
I don't. That's a stock picture. I have no idea what that is, but looks like they're swabbing a patient. Looks like they're swabbing a patient who's maybe intubated in the ICU.
That's a major swab.
That swab. I don't know if they're collecting a sample or not, but the patient's they got an endotracheal tube going as well as a nasogastric tube going. So there's multiple invasive devices there. But what I wanted to show you is this, and so this is the lines of attack, and I'll kind of zoom in. So top left, where it says the SARS-CoV-2 with the circle and the corona, that's the virus that's going to attach to the cell. So the monoclonal antibodies, or the plasma, would block that attachment. So before you get infected, it blocks it. Okay, before it infects a cell, rather, it blocks it. But then if it can attach, then it injects its RNA down to that translation stop. And the RNA is read, and basically that's the cookbook. Hey cell, this is how you make more of me. And so
Right.
the human cell reads that and says, okay, now we're going to get to work and start making more of you. So they start making more of you. So then you see the lopinavir and then the remdesivir, and the remdesivir is down where the RNA from the infectious cell, the virus, is being replicated, and the remdesivir would stop that. That's where being researched for Ebola. But
So it sounds like to me that you're giving all this stuff then, basically. You want to catch it wherever you can.
Well, they're showing the different, in this image, they're showing the different lines of attack potentially. And do you take all of them? I don't think that's the plan now. It's the plan is to say which one is shows the most promise as far as being effective, as well as well tolerated by the human. So all these.
Why aren't they talking about the only thing I've heard about hydroxychloroquine lately is that it has caused more heart issues. And there's some study in France where they had, I guess, determined that it was causing a significant number of heart issues. Is that also what you're hearing?
Yeah, and it's the arrhythmias, and it's if people are sensitive to it or not, and it's also dose dependent. So I think it's a balancing act of what amount we need to give these people for it to be effective. Is it tolerated? Okay. Is that amount tolerated? So there's plenty of people out there that take hydroxychloroquine day in and day out that have lupus or any other like rheumatic type disease, and the dose is much lower and much more tolerated. So when you're giving it to these people in higher doses or in like different formulations, that's what they're trying to figure out. Like, hey, it may work to kill the virus or to stop the virus from replicating, but if it causes more harm than good, then it's not good. So anyhow, that's where the remdesivir would stop the replication. And then down at the bottom here, the virus is repackaging itself and getting spit out the other side of the cell to move on and infect more cells. And that's how the human cell basically is hijacked, the machinery of the human cell. So that's the remdesivir. In case if people hear about, how does this thing work? It works after the cell's been infected. And then the antibodies, the other big one, basically stops the cell from being infected up top there. So again, we'll link that. That was just a good diagram. There's many others out there, but that one was consumable and I think understandable to the masses. So we had that. And then the other thing that caught my eye was, you see all of these feel-good stories in the news, saluting the healthcare workers on the front lines. And, I commend the folks that have to be there in the hospitals and all that day in and day out. We just got them talking about how safe it is for patients, and it is, but it's because of these people practicing and being willing to be the one to triage the sick person and put the sick person over here and take the broken bone over here. So someone's got to do that. Well, so now we get data out from the CDC. Let me get this pulled up here. We get data out from the CDC, the characteristics of the healthcare personnel. And it's by state. They broke this down, and let me get over to the, they basically say that, right here.
It's amazing how much data they have already on this.
At the lowest, 3% of a state's cases were healthcare workers, and then the highest up to 11%. So between 3 and 11% of these states they sampled, depending on how the state is reporting, are showing that of all the cases of the entire state, some of them have 11% of those cases are healthcare workers, healthcare providers. Wow. And to know that if there's 5,000 people in your, or 15,000 people in your state that are infected, and you run a 10% chance of being one of them because you're going to work. I think that's something that it's scary to me. It's something that needs to be commended, and they're not embellishing. They're not embellishing this at all. So this is the data to back that up. So when you see these feel-good stories, of people getting food delivered to healthcare workers, people giving lodging to healthcare workers, things like that. This is the reason why. So
no doubt,
this is some data to back that up. Yeah. So I just wanted to share that. And then the other thing that I thought was interesting was, let me switch over here, and so that's just here. So I had on here, and this is kind of right up what you've been talking about, Joe. It's got released the other day. It's a Stanford study, so it's a United States study in Santa Clara County. They've done broad testing for the antibody. Okay, And the takeaway is this. The takeaway is that, let me click over to the conclusions. That's all you need to see right there. Read that last sentence of the results there. The prevalence estimates, the prevalence estimates represent a range between 48,000 and 81,000 people infected in one county in California by April, 50 to 85-fold more than the numbers of confirmed cases.
Wow. 50 to 85% fold.
No, not percent, fold, like 85 times.
Right. That's what I
So,
said. 50 to 85% fold. Yeah.
Yeah.
Wow.
So Santa Clara County had.
So wait a minute. Stop right there.
Yep.
Let's apply that to our current situation. So Pensacola has how many known infected cases?
Well, Escambia County has 277. So
Okay, so you do the math on this. Do the low end and then do the high end. 50 times
so
and then
two
85
sec-
times.
So it's almost 14,000 on the low end. Okay. And then on the high end, you're looking at 23,500.
All right. So, and then how many people live in Escambia County?
Good question.
I think it's around
I know that
200,
city.
maybe 300,000.
Let's see here. Escambia County population is 320,000. So
at the top end, what percent is that of the population?
24,000 by
10%.
it's like
11,
almost
13.
8%,
8%.
7.5 or 8%. Yeah, 7.5 or 8% of the population. By this, if you apply this logic, 8% of the population of Escambia County has likely been infected or carrying an antibody or is asymptomatic. And then if you use the raw data that we actually have, the 277, or the 282 rather. So 282 divided by 318, it's like 0.08%, less than 1% of the population of Escambia County right now is tested positive. So
Confirmed
confirmed test positive. So that's what they did is in Santa Clara County, they had their confirmed tested positive, and it was 1.5% of the population. And then they said test broad scope, and they found that the prevalence was 50 or 85-fold higher than what they actually confirmed on testing. So then on the conclusion, it says population prevalence estimates can now be used to calibrate epidemic and mortality projections. So
what's the date of this study?
I think it was they did it as far as April. So let's see here. On April 3rd and 4th, we tested county residents for antibodies using a lateral flow. So they did it April 3rd and 4th. So this was infections as of April 1.
Okay.
Basically.
All right. So if you take the numbers that we just extrapolated using our positive cases here, at the top end, how many people die?
We of the infected. So if we have 4 people died out of 280, we have 1.4% of people that have infected people who have died so far. So if you ran our numbers
1.4% by 23,000.
Yeah.
Okay. So whatever 1% of 23,000 is, right? So it says.
Yeah. So
1.3%.
It's 20. It's almost 30 people.
And where are we right now?
Let's see here. So we said that do you want to do it on the high end? Is that what you said?
Yeah, high end and the low end.
Yeah. So let's see here. I'm trying to do the math quickly here. So right now we're going at 1.5 out of every 1 person infected are dying. And then if you multiply that times, okay. I think it basically be multiplying by 50 or 85.
Right.
So you're looking at, we could potentially have 50 people dead,
Right.
or 85 dead when you extrapolate it over time.
Right.
And I mean, yeah, that's pretty tremendous numbers. But I guess the takeaway here wasn't who is dying; it was who is already infected or carrying this around. And this is kind of what we talked about with the Roosevelt, the USS Roosevelt, was how many people were actually sick on that didn't even know it till they tested them. And this is what they did in Santa Clara County.
Santa Clara.
They just,
Well, that's interesting.
Yeah.
And how big is that county?
I wonder if they say on here. I'm sure it's huge. They had already had 256 infections when they started this study. Number of confirmed cases in Santa Clara County is 1,094 by the end of
It says 3,300 adults. So they must not have tested everybody. That can't be.
No, they didn't test everybody, but they tested like a sampling of the population here. So right here, participants were recruited using Facebook ads targeting a representative sample of the county by demographic and geographic characteristics, and they sampled 3,300 people.
Okay.
So, well,
wow.
So anyhow, so it's prevalent, and they're just trying to find some sort of an equation to apply to a population.
I don't know how any business in good faith could ask their employees to get out of their house and come into work and socialize with other people without having tests to show whether who's infected or not. I mean, unless they just feel like, oh, you know what, they're young, even if they are sick, they probably won't die. They just may get, a little infection. But what about all the people they come in contact with? I mean, I just don't get how, for instance, the mayor of Jacksonville can say, go back to the beach. And I know he's trying to keep the social distancing things in place. So he's saying, go to the beach, but don't get near anybody. But I think what it symbolizes, though, is that we're open again. and then you could, when you park at the beach, you're going to park your car right next to somebody else, right? So yeah, maybe you'll lay 6 feet away from them on the beach, and maybe you'll walk 6 feet away from them when you walk on the beach. But are they gonna cross out every other parking space so that you don't ever get within 6 feet of somebody? And are they gonna make single file ingress and egress from the beach, and then have places where you can't walk past? I mean, you're going to be all on top of each other. And I saw a 3D dramatization of what happens to this, the droplets, and it does not go away. It doesn't go like out and then all down together, like to the ground, in one big like waterfall. It goes like whoosh, and it just like sort of floats around for several feet. And the finer the particles are, the more it just sort of clouds around for a while. And I know it sounds crazy. The whole thing sounds crazy to me. The whole subject of this contagion situation is crazy, but this is truly a respiratory disease that is transmitted with our respiratory system. So we're breathing constantly into the air, and we're exhaling all kinds of stuff into the air, gases, particles, droplets, whatever. And if those now contain some kind of disease, we're walking through it. And if the more people you have in a room, even if they're 7 feet away, the more of that stuff is going to be just fogging around that you can't see. So I don't know. We need more testing. And it's not a federal government. It's not a state government. It's a government thing. The federal government has a role in helping us get all the stuff. The state government has a role in making sure the test locations and procedures are set up right and are equipped with the National Guard or whoever. I saw this morning they had two testing facilities that you could walk up to in South Florida. And I thought to myself, well, that's two. There should be two in every county in Florida that are running these tests that you walk up and get. I mean, I don't understand how cavalier we're being. And I get the whole economy part of this. I understand that we don't need to allow the economy just to go off the deep end. But what's going to happen to the economy on the deep end if we ignore this, the reality of the situation, and we end up going back and then coming back to where we are and then some? And it's worse. The economy is going to suffer a lot more the second time this happens, if there's an immediate reoccurrence that's worse. So look, if we're functioning right now and we got a D- and people aren't dying, okay, at an alarming rate, and they're not being infected at an alarming rate, and we're starting to assimilate back, why don't we just stay at this level for a while? You know? And I know they're talking about staging, whatever, but the idea that you send the message that beaches are open and that everything's back open for business is the minute everybody's going to think, you know what, I don't need to stay at home anymore. I was going crazy at home anyway. Let's just go. The governor said, the mayor said, whoever said, it's okay to go out. I just don't think that's a good idea without widespread testing and contact tracing. There I am again. Go ahead. Sorry.
Well, no, you've mentioned this multiple times. So of course I'm sitting here doing my research, and I thought I'd share this. And this is less medical than anything, but you had made the comment that this is you, from your standpoint, in your interest, saying, you know, hey, we need to stay home longer. It's counter to your interest as far
Way
as
counter to
business.
my interest.
So
Yes.
this backs that up. Oops, wrong one. Let's see here. This backs that up. Right here.
Yep.
So that's the title. And
So
this
let's see
is this is from 2 years ago. So right, results reveal a significant 2.9% decrease in motor vehicle fatality rate for each percentage point increase in unemployment rate.
Wow.
And this was 2016.
Changes in risk of driving rather
than the amount of driving.
Oh, so less people on the road because less people working.
Yep.
Is that what they're saying here?
Yeah. So it's crashes to do with large commercial trucks, multiple vehicles, speeding cars, things like that. So anyhow, we'll share this. And it's not a medical thing. It's more of a societal or sociology kind of a study.
And we typically average between 15 and 30 new car wreck cases a week. And ever since this started, we're down somewhere around, we're in single digits still. So, which is great for people that are not getting hurt, but this is bad for business for me. And I'm telling you, we should continue doing it. So maybe I'm not being smart. Maybe I should be like everybody else that wants to see the economy just skyrocket, including my own economy, right? And I should just say, you know what, let's just take a chance. But I don't know that that's the most responsible thing for me to be saying. And that's why I'm not saying it, okay? So anyway, long and short, we seem to have social distancing issues here. The tidbits of news I've seen today, both in Santa Rosa and Escambia, seem not to be so positive. I'll just say that. The last 4 weekends, I've said, we're not going to come back over the weekend unless something big happens locally. I'm going to say the same thing now. We're not going to come back on this video unless something big happens locally. Hopefully it won't. It has not in the last 4 weekends. Next week's going to be the 6th week where the office is working mainly remotely. There's only been 1 or 2 people in the office at a time. We have like 10,000 square feet. And so 12 actually counting the other space upstairs. And so that's 2 people and 12,000 square feet and an up and a down. And so we're doing social distancing, and then everybody else in the firm is at their own house. They don't ever leave.
I haven't been in the office since
I don't think. Where do you sleep, in that chair?
No, I haven't been to the office since St. Patrick's Day. I remember that was my last day there.
Michelle, I know Michelle sleeps here. I'm pretty sure. I think she just stays here. All right. So thank you, Dr. Malone, for all that helpful information. My hope is we don't have to interrupt people's weekends with bad news about the virus. But you can, of course, if people are not social distancing and there's a car wreck or there's some kind of injury that happens, we are wide open for that. I work pretty much around the clock every day, weekends, included. So you can find us on the web at zarzaurlaw.com. The phone number is 855-HIRE-JOE. You can comment under this video if you have questions about this subject matter. We'll try to answer those, or you can email us at info@zarzaurlaw. Dr. Malone, have a good weekend. Hopefully we won't be back on here until Monday. And thank y'all very much. Try to do some social distancing, get our score up from a C or a D up to a B or an A. And in Santa Rosa, if you're watching this, you're an F. So try to do, you probably could do a little bit and make a D. I mean, just, I don't know. Stay home, don't go to the grocery store once, but once on the weekend, maybe. Maybe not congregate at seafood places. I've noticed that. Joe Patty's and Maria's, the line is out the door and around the corner. And of course, they got this tape on the ground every 5.5, 6 feet, which is a little bit, I guess they're trying to do something, but I mean, they're all just jammed in there and they're waiting for, looks like hours, and they're, you know, breathing and coughing on each other. I mean, it's just like, oh God. And so now that 3D, that I wish I had that 3D thing that I could put up here. Maybe I'll try to find it and get it to Michelle, but it did show the difference between having a mask on and how little gets out versus not having a mask on. I mean, it's like this humongous cloud that comes out of your mouth when you cough and sneeze. And then when you had the mask on, it was just like a little puff that went up by your nose. It was like a tiny little puff that just went up here and it just like got on your face or something, and it didn't go anywhere else. So this whole mask thing sounds like we need to be paying more attention to it, because it looks like from that it matters, especially if you're going to go to a place where there's other people. Oh, and I also heard the first lawsuit was filed related to having to go back to work. There was also a lawsuit over some nursing home stuff that was filed in New York City. Long and short of it is, let's not get to that point where we're having to file lawsuits. Let's do the responsible thing on the front side, right? Okay. We'll see you on Monday. Thank y'all. Stay safe.
Bye now.